On behalf of the Carlo Center, I would like to welcome you all, and would also like to welcome Sandra Brayman, who is at Abbott Professor of Liberal Arts in the Department of Communication at Texas A&M University. She has probably like nobody else pioneered the topic of information policy over her long and distinguished career. Many of us know, the first edition of her book, Change of State, published in 2006. And from my talks there, I know there's a second edition in preparation. She has had her research funded by many foundations, including Rockefeller, the Ford Foundation, the National Science Foundation, among others. She has chaired major roles in major international professional associations, including the International Communication Association, the International Association for Media and Communication Research, among others. Her distinguished career was honored with the status of Fellow of the International Communication Association in 2014. She has taught in many places worldwide, including in South Africa, where she actually founded the first information policy program on the entire continent of Africa. She has been associated with universities in Norway, Sweden, Brazil. And it's a great pleasure to have you here, Sandra. She is also the editor of the MIT Information Policy Series, which has been phenomenally innovative and has really published lots of really interesting contributions to the field. So Sandra, it's a great pleasure to welcome you. Thanks for taking the time, and I'll turn it over to you.
Thank you for the invitation. Thank you to all of you for coming. I appreciate the opportunity. I'm gonna just make one change to the bio, which I also much appreciated, and that's that what was going to be the second edition of Change of State will now be a second volume, because there's so much new material that it couldn't be squeezed into a second edition, and there's too much material in the first that has to stay in the first volume that has to stay there. So as a heads up, the working title at the moment is Late Governance. So this talk I'm giving today is on research that started as a journal article and has exploded into a book. This is the first time I'll be presenting from the material, and so I'll be, it's a bit of a tasting menu, but I'm very much interested in your responses to and critiques of the conceptualizations and the approach being taken. So with all that said, I'm gonna jump in and try to share my screen. We're good, I take it? So the argument I'm presenting is that information policy analysis is a form of legal epidemiology, which is the study of the law as a determinant of health. Information policy has been significantly affected by the pandemic. Because information policy is always parametric policy, changes in this domain affect the nature of governance itself. This is always true, but in the case of the pandemic, this significantly exacerbates, I guess it's ongoing, other pressures of the medical emergency on the nature of governance. Many of these changes in law and policy appear to be ephemeral and incremental in nature, but the effects will be enduring and in some cases will be radical. So I will work through that argument in these stages today. Starting with some key concepts, I use a very broad definition of information policy to be laws, regulations, implementation programs, and policies affecting any type of information creation, processing, flows, and use. So it's an umbrella concept. Colloquially, we can think of it as law and policy for information, communication, and culture. It's not on the slide, but I think of that as it relates to the formal processes of government, the formal and informal developments that come from both the public and private sector, and the cultural forces of governmentality that support and enable both government and governance. And that's the definition used for the MIT Press book series as well. Information policy is parametric, meaning that it determines the boundaries of systems, social, technological, and informational systems, as well as what happens within each system and between systems at the same infra and supra levels. Legal epidemiology is the study of laws and determinant of health. I never even knew what legal epidemiology was until the pandemic. But we come to think of broadband access, for example, is now being recognized as a super determinant of health conditions. What the relation between information policy and the complex adaptive system that is the state. Typically, law and policy evolve slowly and incrementally. Such processes can be punctuated, as has happened here, as happened with 9/11, as happened, I would argue, under Trump. But it's because of this parametric nature that changes are affecting the nature of governance itself. Historians of the law think of this period of transformations in law-state society relations as equivalent in their profundity to those of the Westphalian period. There were several studies that will contribute to this book. The first was the Research Alert. What was I looking at that drove me to engage in this research? I did a comprehensive secondary analysis of the pertinent scholarly literatures to think through information policy as legal epidemiology. I'm doing inductive analysis of all COVID-19 related bills and resolutions presented to Congress from January through the close of May 2020. And then I'm going to look at the legal realities of COVID-19 at the extremes by doing a comparative analysis of actual changes in the law in that time period in Texas at one end of the spectrum and California at the other. In terms of thinking about because technology, there are numerous variables that are appearing in the analysis of proposed bills and actual laws. I'll also be doing discourse analysis of debates over these bills, congressional hearings, media coverage, and all the other things one looks at when one does discourse analysis. For understanding the contrail effect, and by the contrail effect, I mean that changes that are small, incremental, and ephemeral in nature, like the steam trails that we see from airplanes and jets in the sky, known as the contrail, actually, when they combine and interact, can have enduring effects that are really consequential, as environmental scientists have found with the contrails, aeronautical contrails. To study the contrail effect of what's happening to the law under COVID-19 conditions, we will, for looking at as imagined, I'm looking at explicit references to after the emergency that are in proposed and bills and laws that are in place. De facto things, so once students have been given laptops, they have the laptops, and the enduring presence of the ideas introduced in ongoing discourses because some issues are being really reconceptualized. In teams of the de jure contrail effect, that'll be analysis of laws and regulations actually in place that came out of the proposals as they stand as of summer of 2022 at the federal level and in California and Texas. And then Westlaw Edge is an AI-driven bit of software that analyzes what's going on with bills that are proposed, among other things. And I'm using that to analyze the likelihood of passage of laws that are currently under discussion. The Research Alert, just to let you know what got me started, I just started poking around in spring of 2020. And I found that Texas had already decided that decisions to put new state bonds, tax mechanisms in place, could be made by one person only without talking to anybody. And so no public meetings and no need necessarily to talk to anybody else, even inside of government. And the justification for that was people can't get together. So of course you got to let one guy do it all by himself. Texas has been providing national leadership trying to get rid of open meeting laws because they claim it infringes on the First Amendment rights of politicians. In spring of 2020, the state was already doing wildly varying treatment of open meeting laws, from saying we can't have them at all because people can't get together, to severely limiting individuals who could participate in a variety of ways. And one of the, I guess it didn't make it into the slide deck, but one of the things that is fascinating in all of this is constant policymaker reference to technologies and assumptions about uses and effects of uses that has no relationship to what we actually know from research. They're just making stuff up out of their heads. The third bit that grabbed my attention was the waivers of building code requirements for construction along the Gulf coast. So do not buy your second home on the Gulf Coast of Texas if it was built in 2020 or later, because they don't have to meet the building code. So that was justified by claims of supply chain issues, irrespective of the safety consequences. I found all three of these things, and there were more, so alarming that I thought it was worth really doing sustained research on it. So here goes with the first mapping ever of information policy is from a legal epidemiology perspective. As we traditionally understand information policy issues, there are 16 different issue areas that are pertinent. I say as traditionally understood because what's happened during the pandemic has made new kinds of issues become visible. We can group these 16 traditional issues into these 5 categories, and I'll just try to work them through quickly. So in the area of commercial speech, which can of course either mandate it like labels on cigarette packages or forbid it as advertising claims without scientific support, the biggest COVID-19 issue has been fraud regarding medical equipment, preventive resources, pharmaceuticals. There has been so much fraud that this is now a priority for the US Department of Justice. Freedom of religion has historically been a public health matter regarding vaccine resistance, contraception, and abortion. The biggest issue during COVID-19 has actually been restrictions on religious gatherings. It's been politics about vaccine resistance, not religion. The religious issue is restrictions on religious gatherings. Based on a 1905 US Supreme Court decision, the Supreme Court was regularly upholding restrictions on religious gatherings until Justice Amy Coney Barrett joined the court when there was an abrupt change and they backed away from supporting those restrictions. In terms of censorship, the first COVID-19 free speech issue of concern that came up was raised by the World Health Organization and others who believe that had there been less censorship in China, the world would have known much more about the coronavirus than earlier, and it would have helped prevent it becoming from becoming a worldwide pandemic at the level at which we've experienced it. Censorship-related efforts under Trump included gag orders, firing government employees, demoting government employees, so putting top-level people into filing cabinet people, efforts to get government employees to change data. As a result, legally protected whistleblowing became extremely important, and there are a lot of lawsuits underway right now about these censorship-related efforts by Trump. Political speech is always at stake during national security emergencies, but the extent to which this is the case during a medical emergency is unprecedented. So one thing that jumped out when I started doing research in this area is that, of course, there's a long history of thinking about matters like free speech and privacy when it comes to national security concerns, but this is the first time we've thought about these things when it comes to a medical emergency rather than one driven by national security. So we're seeing medical communication, of course, being treated as political affiliation and a form of political speech. Refusing to mask is a form of what in US law is considered symbolic speech, which is protected under the First Amendment unless it interferes with government processes. So in the 1960s, for example, there were a lot of symbolic speech cases, and it was decided that it was not okay to burn draft cards that interfered with a government process. The government had to go find those people and get them draft cards again and make sure they knew where they were. But burning your bra, which feminists were doing in that period, was okay because it didn't interfere with any government processes. The question I don't know, and this is going to be worthy of a journal article in its own, since refusing to mask is known to contribute to contagion, impeding government efforts to stop the contagion, it seems to me that this is a First Amendment analysis that could be brought into play about refusing to mask. Political demonstrations themselves turned out to be super spreaders, and that was exacerbated when tear gas and pepper spray are used. So here, COVID-19 intersected with the Black Lives Matter movement, all those things around George Floyd and so forth. When it comes to misinformation, the World Health Organization refers to COVID-19 as an infodemic because misinformation has been so problematic. And here I'm using as is commonly done, misinformation is the umbrella term for false information for any reason at all, including simple error, and disinformation for the deliberate production and distribution of false information with the intention of causing harm to individuals, groups, and our society. Misinformation and disinformation can stimulate behaviors that cause contagion. In the US, consumer protection law and torts of media liability and intentional or reckless disregard causing emotional distress are coming into play to try to deal with medically related disinformation in particular, because under the First Amendment, it's otherwise very difficult to get a hold of. Interestingly, misinformation is specifically mentioned in a number of bills proposed to US Congress during that first 5-month period of the pandemic. I'm believing these may be the first references to misinformation in proposed legislation or in legislation that passes. I don't know that certainly, but that's a hypothesis. And certainly it's commonly there. In the domain of intellectual property rights, we got copyright. It was a big boost to the open access movement. Many publishers, including Springer even, have been and are still offering open access to all COVID-19 related research. There's a push to extend the first sale doctrine to digital works. In US law, the first sale doctrine lets libraries loan out a physical copy of a book once it has been acquired in physical form. When education went online, we realized that was necessary for materials used in education and for other purposes. There are differences in licenses, but there was a push to make it easier for educational institutions to afford digital copies of everything that was being used in teaching using a first sale-like doctrine rather than requiring them to get much more expensive licenses. There were also property rights issues raised for online activities that are not typically covered when in person, church services. Commoditization effects have been keen. The literature references online teaching, but of course that was an issue in the 90s when many institutions tried to claim intellectual property rights over online courses. The commoditization effects that we're all feeling, I don't know about the rest of you, but when professional associations started referring to our conference papers as assets, I found it rather offensive. In the world of patents, of course, the problem is that patented pharmaceuticals are tremendously expensive, and the patent process itself is so time consuming that it slowed the production of both vaccines and medical equipment. There is in international trade law, there are actually several means by which states can require compulsory licensing, but states have been reluctant to do so. And to my knowledge, it hasn't yet happened with COVID-19, nor have any of the other legal tools for doing that been used. However, voluntarily choosing not to patent and giving away necessary scientific and production information has happened. All hats off to Drs. Hotez and Bottazi, who were supported by their hospitals, Texas Children's and Baylor College of Medicine, to give away a new vaccine that they've developed. And they're giving both the information about the pharmaceutical and production information free to institutions and countries around the world, simply because they thought it was the right thing to do. So hopefully others will follow that outstanding role model. Illegal trademark, use of trademarks is a great tool for those engaged in fraud. That first started showing up in April of 2020. That's been myriad since. That one's complicated. There are 5 different US government agencies that get involved in addressing those kinds of trademark issues. In terms of access to information, we can start with government communication campaigns, typically for epidemics. That begins with declaration of a medical emergency. There were actually 3 declarations in the US. As those of us in the US know, that government did not do a particularly good job with its ongoing campaigns, confused by the misinformation, disinformation, and politicization of health communication, along with, of course, the public's inability, endemic inability to understand what it means to accrue scientific information and have understandings change over time, and that in fact the pandemic itself was changing over time. The argument has been made that public health agencies should actually be thought of as communication organizations, and author Garrett urged WHO to actually set up a new unit of communication experts just focused on the pandemic. In order to have access to information, it has to be collected. 2020 COVID-19 dashboards were critiqued for failing to meet a number of, there are actually 15 evaluative criteria for medical information dashboards that were irregularly followed, and none of them succeeded in meeting all those criteria. Many of the proposed bills have emphasized the need to collect information and more information and collect it better and release it more accurately. The Freedom of Information Act, there was a mandate to expedite FOIA requests for COVID-19 related information if of imminent importance to individuals or the community, or if the public had a need to know regarding government activities. So there were new FOIA requests, new categories of FOIA requests on things like, what on earth is the government doing with masks? You may recall that the Trump government was going to states and seizing equipment without any prior warning, any explanation of why they were doing it, any explanation of where that equipment was going. Different agencies, though, have been handling these requests in many different ways. So the FBI would only accept mailed-in requests, and they've got reduced staff to handle those because of social distancing. The CDC would only accept electronic submissions. Types of information, and this is again a beep, 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 beep about what's happening to the nature of governments. Types of information historically available under FOIA became unavailable. And sometimes some of these didn't even require FOIA. It was information that was available on government websites always. So for example, the Environmental Protection Agency relaxed requirements to monitor toxic emissions, relieving companies from liability for releasing toxic emissions. And there was never any explanation as to why that was necessary for COVID-19 related reasons. One of the things in both legislation that has already been passed and in proposed legislation is that often the relationship to the pandemic is only in a footnote that basically says because pandemic or because COVID-19, with no actual analysis of why the change in what's going on in governments was, of what the relationship could possibly have been. Another example of that was that elder care facilities were relieved of liability for matters that might be the subjects of complaint that had to be reported, so they stopped reporting. We also saw regular government reports that stopped when they had negative findings. So the Census Bureau was doing, as an example, was doing weekly survey of the quality of life, stopped releasing those reports and stopped then engaging in the surveys when it found that under the pandemic, there were negative impacts on access to food, access to the internet, and mental health was declining. So less. Whistleblowing in international law is protected, and under US law, it's legally protected when it's about illegal or harmful actions taken by one's employer in the US. That includes your government as employer. It is among the protections are that it's illegal for employers to retaliate. When the Trump government blocked the release of COVID-19 information or had it falsified, whistleblowers were incredibly important, providing critical access to information regarding disease spread, health system failures, corruption, the inadequacy and inequity of supply chains, health and labor law violations, government procurement problems. There was severe and widespread retaliation, and that resulted in numerous lawsuits, some of which are still underway, some of which have already been won. The Government Accountability Project is a nonprofit advocacy organization that collects data on whistleblowing, and it describes the pandemic as the biggest attack on whistleblowers in US history. Members of this audience are probably most familiar with what happened in the area of broadband. Again, now considered to be a super determinant of health, but typically references to it either in the public health literature or in the proposed laws, actual laws, or the legal discourse actually ignore the legal context for what makes broadband access possible. It has a long history from a medical perspective. Serving medical needs was actually one of the earliest goals of the internet design process. It shows up in the Internet Request for Comments in 1971. The Department of Health and Human Services became directly involved in that design process by the late 1980s. And by the early 21st century, specific internet design problems pertinent to health issues were being addressed directly. COVID, though, introduced a number of turning points. It was really the first time that its use for telemedicine, telehealth purposes was heavy, and in many cases became preferred. It was the first time digital tools were used for non-clinical purposes, and the first time those in public health actually acknowledged its importance. Congress took numerous steps to support institutions, equipment, and access to the network for medical and educational institutions and libraries, and mandates to insurance companies to cover telehealth engagements in the same way that they were providing support for face-to-face meetings with your physicians. Providers also voluntarily reduced or dropped fees and data limits, sometimes increased data limits under various circumstances, depending on the provider, and for time periods that varied, depending on the provider. The FCC, there were also changes with the spectrum. So the FCC gave additional bandwidth to 33 wireless providers, in some cases doing so at the cost of the ability of other providers to offer services in ways that will affect the market long-term because of path dependencies. So this is one of the contrail effect kinds of developments. Cybersecurity attacks actually increased by 500% as quickly as April 2020. I don't know what the current figure is on that. They involve fraud, hate crimes, phishing, and cyber attacks on health organizations, actually shutting down hospitals or holding them hostage. Teleconferencing, of course, introduced lots of new vulnerabilities in ways that interacted with the easing of health privacy regulations. So until before the government actually eased data privacy regulations for health, related to health, anecdotally, people have said, physicians said they thought it was more important to provide the healthcare than to follow every dot of the law. If on privacy, if doing so meant they couldn't provide the healthcare, and then the government came around and eased the privacy regulations. There's also research showing that exhausted healthcare workers were more likely to open phishing emails, more likely to make mistakes. It turns out that health information sells for 10 to 20 times the amount that can be asked for information about your social security number or your credit card numbers. Who knew? In terms of democratic processes, the census, of course, is foundational for determining political representation and the distribution of resources, including medical resources. US Census tracts were actually initially referred to as sanitary areas. They were first conceived of and used for health purposes in 1920 when the Census Bureau started collaborating with state and local health departments to support public health planning and delivery. At this point, critics note the non-alignment of census and public health statistics, how they define their categories, so that obscures the information about the differential vulnerability of various populations, whether that's by ethnicity, race, or geographic location. We, of course, know that the distribution of health resources has been highly differential across populations in the US. COVID-19 significantly reduced the comprehensiveness of the 2020 census. The most important, that happened in many ways, but the most important to highlight is that they cut way back on visits to households to people who were not submitting their forms online. Household visits are most important to make sure you've tracked who's in marginalized populations. So if you stop those visits, then those populations disappear. That development intersects with gerrymandering and changes in voting laws for really long-term consequences for the actual representativeness of US democracy. In terms of voting, some claim there's no historical precedent for the 2020 voting emergency. That is, of course, just due to COVID that interacted with cyber attacks, political polarization, and civil unrest. The US government did provide funds to help support additional costs for in-person and mail-in voting. You know, equipment was needed, maybe more space was needed, and so on. And a lot of support was needed for expanded mail-in voting. But those changes in voting procedures continue to fuel both those who claim the outcome of elections was fraudulent and the passage of ever more restrictive voting laws by states. One of the things that happened that was quite distressing was that vote by mail efforts by those in apartment buildings were treated by fraudulent past the first person from the street address in a lot of jurisdictions. In other words, if there were 100 apartments in a building, the first vote by mail that came in from that building would be accepted, and all of the others would be treated as fraudulent because of the street address, ignoring apartment numbers that meant they were different residences and different legitimate voters. Research is also showing that the slowing and shutting down of immigration services because COVID also affected voting, because people who would have been eligible to vote weren't able to because the completion of their paperwork was stopped. In terms of the legal imaginaries, there was an extraordinary outburst of legislative proposals in the first months of the pandemic. Over 600 bills and resolutions were presented to Congress between the first declaration of a medical emergency in January and the end of May 2020. Almost every person, I think it was only one or two individuals, every person in Congress sponsored or co-sponsored from one to a couple of dozen bills. Preliminary findings are showing that Democrats sponsored more bills than did Republicans, but that's preliminary. So we shall see. And bills, when assigned to committees, went to almost every committee on both the House and Senate sides. The imaginaries were both progressive and conservative. At the close of May 2020, those proposed to Congress at the federal level were largely progressive. The only bills I've seen so far, and I'm about halfway through analyzing those over 600 bills, the only ones I've seen that were resubmissions of bills that had failed in the past were on the conservative side. Ted Cruz was notable for this. The laws that were in place in Texas were largely conservative. This could be an artifact of the fact that the Texas legislature meets for only a few weeks every other year, so those in power at the top could act, and there was no opportunity for proposals to come from elsewhere, including the legislature. It could be the difference between what's proposed and what laws actually pass. It could be the difference between executive and legislative decision-making. So too soon to tell on this front, but that's one of the questions I have, one of the things I'm going to be looking at. Many of the imaginaries might have been guessed, so financial security, housing security, food security, care for the elderly, care for children and students, support for education, equity for historically marginalized groups. But some were more surprising. So there are calls for intensification of training in media literacy, in offering financial literacy training because COVID, in the creation of new markets. This was a real surprise to me. Expansion of the category of those who have suffered from COVID to include victims of sexual abuse. I can see the arguments for people trapped in homes. Some of the imaginaries redressed outstanding and much discussed lacunae in current legislation. So a notable example familiar to most people in this room would be the extension of broadband and library support services to tribal jurisdictions. There'll be a lot more detail on that in the book. The because technology argument. ICTs play fundamental roles in information policy as legal epidemiology and in the consequences of their developments on the nature of governance itself. We're finding that conceptualizations of technology for policymaking purposes are changing. There have been 3 inversions in how we think about it, and there'll be a lot more details on this in the book, but I'll go through the first 3 of these and offer a bit more detail here. Historically, for policymaking purposes, if we think very abstractly, we've thought of technology ontologically in arguments for innovation for the sake of innovation, as in intellectual property rights in the US Constitution. We've thought about it as a content carrier, the medium for information and communication of political, cultural, social, and economic importance. And we've thought of technologies as a tool of agency for diverse purposes, including the industrial. And at the moment, we're of course negotiating whether it's AI or humans who are actually using the tool of as a means of agency, tools as agents. Since COVID-19, we're seeing technology for policymaking and analysis purposes in some different ways. What the first thing that really jumped out is it's being used as a rationale for laws and policies, as I mentioned earlier, in wildly differing ways that have nothing to do with and never bother referring to research we actually know on uses and the effects of uses of technologies. So this is just, we have to do it this way because of the technology, because the technology requires us to do it, because of real or imagined characteristics of the technologies, because we need it, because we have no choice, really just because technology. We have come to see COVID-19 as infrastructure, as broadly understood as infrastructure. Of course, many who do research in this area, many people in this room have understood it as infrastructure, meaning necessary for the support of all social processes for a long time, but now that has finally gotten through to everybody. And so the legal imaginaries, finally, again, include describing the internet, access to the internet as a basic human need. This is a change. It's also become a key player in the social construction of reality. I've published on, I won't take the time here to work through the argument, but there are profound epistemological impact on each element of the production of Lockean fact and its contributions to the social construction of reality. I'll just make that point here and can go back to it in Q&A if anyone wants it, or point you to the publication. COVID-19 related legal changes have made the ways in which this is affecting governance visible to researchers, and I'm going to talk about a couple of those when I talk about changes in the nature of governance. The first inversion that we've noticed is that historically policymaking is focused on the technologies, not its uses or effects. A few exceptions: helping railroads got the first telegraph bill through Congress, but in general, it's whether or not they should support the technology. In the face of questions about why and what difference it would make. I vividly remember still a cover story from The Economist in the mid-'80s on the question of whether or not it was worth extending the telephone through North Africa. In that period, people flew to Cyprus to make phone calls. They had looked at whether or not the telephone would even make a difference, and they had analyses varying by orders of magnitude, like 10,000% differences in what difference they thought it would make. But now it's the uses and effects that are driving policymaking. So I'm thinking of this as analogous to the change in research on media effects from the early 20th century to today. Very briefly, that went from, started with an emphasis on the sender and the silver bullet. Everybody will be affected the same way by a message, and that will be as the sender intended it, through thinking there were lots of intervening effects and so actually effects were weak and not strong in the 60s and 70s, to by the end of the 20th century thinking, no, it's the audience that's making meaning, and the audience gained in importance for understanding what's driving media effects. And now audience analytics are actually the gatekeepers for journalists. So it's become a much stronger audience. I'm thinking the same kind of change is happening with the relationship between technology and effects when it comes to how we're making policy and thinking about it. So most proposed legislation now is focusing on uses, not the technology or the access issues at all, starting with education or telehealth rather than starting with the internet. The second inversion is a reversal of the relative importance of manifest and latent information policy. Borrowing from Merton, matters that are explicitly information policy, such as free speech, we can think of as manifest information policy. Those that affect information indirectly, like regulation of logging, which has an impact on paper production, and thus is an information policy issue, but it's indirect. We can think of those as latent. Historically, we paid much, much more attention to manifest information policy. Latent information policy has received almost no attention in policy analysis. But with COVID-19, we're finding that latent information policy is driving most technology and other information policymaking. So again, we see mandates regarding education, social distancing, and so on are de facto technology and information policy and involve lots of kinds of information policy mandates without ever referencing them. They're focused on what historically would have been considered, they're starting with what would historically have been considered latent information policy, but it has now become dominant. The third inversion is that the two faces of information policy have also reversed their positions. So the first phase, the one that we think of most often, is that we pursue information policy issues because they're of value in their own right, like free speech. The second phase is pursuit of information policy issues because of their value as enablers and inputs into policymaking on other matters like health. Again, now there's been an inversion, and we're thinking much more about the role of information policy for health purposes rather than necessarily starting from the free speech. This isn't a complete inversion to the extent that I think the other two have happened, but it's happening. In terms of changes in governance, just a few examples, but they're incredibly important. The first is in the nature of judicial processes and legal arguments, and two examples here. With the US Supreme Court, until COVID-19, these oral arguments were always face-to-face. Each issue raised would be explored in turn until it was exhausted, with all justices asking questions related to the one topic before the court as a whole moved on to the next topic. With teleconferencing, they completely changed that, and this was a Roberts decision as I understand it. Each justice took the screen at a time to ask all of his or her questions on all issues before moving on to the next person, who would then ask all of their questions on all issues. This is a radical change in the way in which arguments and information are presented. It must necessarily affect the ways in which the information is analyzed, decisions made, and opinions written. This is currently receiving significant analysis by legal scholars. And this is non-trivial, and of course it's happening at other courts, but so far most legal scholarship has looked at the Supreme Court. Second example is how civil courts operate, and this was really fascinating and eye-opener to me. Civil courts are really about problem solving, not about oppositional litigation. So there's a research team that had been working before COVID-19, doing ethnography and using a wide variety of research methods on what's really happening with civil courts. And they find that although there are forms to be filed and processes to follow, the most effective problem solving is achieved through a wide variety of types of interpersonal interactions with everyone on the staffs of civil courts who share information and offer advice. So individuals are walking into the courthouse and talking to one staff member after another, varying kinds of job titles, and getting advice about what to do and working their way through how to resolve a real life problem that they have. It's not about oppositional litigation. So it's very thick interpersonal interaction that's the core of how civil court cases are resolved. That's gone in the online environment. So the people who have those problems are now faced with just the formal paperwork and processes on their own that they have very little capacity to manage. This has first been studied with civil courts. I believe that taking the same approach to understanding even what's happening with political decision-making when you haven't got hallway conversations and in a lot of other environments will be revelatory as well regarding the change between thick and thin communications in the course of complex decision-making processes. A surprising number of proposed bills and laws passed involved changes in the organizational structure of the US government. So a lot of cross-agency, a lot of cross-agency coordination, expansion of the responsibilities of what we might call governance intermediaries. We think of third-party intermediaries in the internet environment, but we can think of those in the governance environment as well. Private sector institutions with responsibilities to implement government policies. A number of new governance intermediaries were created. And then there's also the creation of new markets, which we can think of in both institutional and economic terms. This is very new to me. I understand very little about it and need to contextualize that vis-a-vis the history of the governmental creation of new markets. Where this came up first was in the area of housing loans. Then there's the oh, never mind approach to changing governance. Regulatory waivers are one of the most heavily used tools in laws passed and in laws proposed. Some are clearly related to COVID and are progressive and generous, like postponing or forgiving student loans or rent. For many, no clear relationship and the effects undermine existing policies. So a couple of examples. I mentioned the waivers of the requirements to report to the government on what's happening in elder care facilities and on environmental hazards. I have not yet seen the COVID relationship. And again, many of examples here just have the footnote that says because COVID and don't explain it. Some take the form of postponing the implementation of new policies that had become laws that will protect citizens and consumers. One example was there was a proposed, there was a tightening of security regulations that was to have come into play, to have been implemented in the first months of 2020, and they postponed it. And again, there was no clear relationship to why postponing a tightening of security regulations, whatever that had to do with the pandemic. So again, the contrary effect is that changes in law and policy that appear to be incremental and ephemeral, like the steam trails of airplanes and jets, can, in interaction and combined, yield enduring consequences of importance, as environmentalists have found is true of aeronautic contrails. The contrail effect is evident with COVID-19 related legal change and proposed legal change in the language of the bills themselves. Some of them talk about what will happen after the medical emergency. In the de facto consequences, the students have their laptops, and in shifts in policy frames, like actually seeing the internet as infrastructure and a basic human need. Research that's still in progress will provide insight into how this effect has become embedded in law to date. It will take us a number of years to see in the long term how that spells out. I believe that understanding the contrail effect adds conceptually to our understanding of the nature of policymaking processes and their evolution. The analysis in book length form will link with other changes in the nature of governance and with the implications of legal responses to the digital shock of COVID-19 on the parametric effects of changes in information policy. I want to give thanks to all of the students who were involved with this project and to the funders who helped me get to this point. And over to you. Thank you so much for listening.
Thank you. Thank you very much for this absolutely fascinating tour de force, if I may call it like this. So the floor is open for questions, for comments, for feedback. Let's it's a manageable group, so please just feel free to speak up or raise your hand. And I have I think Marjorie, you were first, and then Peter, you on my screen.
I guess I can sum this up by saying, wow, Sandra. So I look forward to reading more text, but this has been amazing. I have a couple of, because there are so many things I could react to. As I listen to, so I'm going to go backwards. As I listened to your summing up of the contrail effect, it did make me wonder about the concept of emergence. And, you know, from past engagement with the Santa Fe Institute and their consideration of emergent phenomena, I wondered whether you had looked at that. And then the other comment I would make is that, and question is whether situations like what you described for judicial processes, and maybe for other processes as well, but the idea came to me when you were talking about that, is whether in a way what we're seeing now with today's technology anticipates and lets us think about the policy implications of the new metaverse concepts that are overly hyped, but that show an expectation for more interaction in virtual spaces, and possibly virtual spaces that will have design features that overcome some of the ones that you described for the Supreme Court and the civil justice institutions. Anyway, just a wonderful talk. Thank you.
Thank you. Those are both terrific questions on the emergence, because I'm always thinking about complex adaptive systems theory. Emergence is always there. I feel like I don't know enough yet to see how much is, I get the sense that there's a struggle between those who are thinking, a moment when we can make some really dramatic changes. And actually, I had a pair of co-authors for the book series, for the MIT Press book series, young people who thought this is really, they had a dashboard for all the things that were happening at community levels, like sharing food and all, and they really believed it was going to be a radical change. And I looked at them and I thought, oh, you're young. And then actually 6 months later, they said, oh, we see this isn't going to happen, and they dropped the project. but I think there are policy windows in which changes are more possible than at other times. But it's also clearly being used, and that's why the comparing, contrasting Texas and California will be important. It's also clearly being used to push forward agendas that have long been in place but have been stymied. So I feel like I don't know enough to fully explore that yet. In terms of the second, I love it. I hadn't thought in that direction, but I do have a piece in press right now on Meta that I'm calling A Short Meditation on Media Economics. It's in a handbook on media economics. They're going to be shocked, the people who see it there, but in which I actually argue, if we ask as a quick way of summarizing it, there's always this question of what is it that we're mediating? Is it the sender receiver, a common longstanding thing? Early in the 21st century, I argued that we were really mediating the nature of the public. And I think that the metaverse thing, side point, this involved, Johannes, this is where I was going to SIC codes and what Meta and Facebook claim they're doing as an industry, which is very hidden, is that because of the ways in which use of these technologies changes the way in which we cognitively process information, that people right now are talking about the metaverse. We think of the economy as flat and the market is flat and policy implications as flat, but I think they're working multiple generations ahead, and that what they're going to be mediating is a species. So, but I hadn't thought about it in conjunction with this, but I think your insight is a great one. Thank you.
Peter, you're next, and then Steve.
Excellent presentation. So one question, one comment. So the first question is about the laws, legislative bills, and cases you have collected. I'm curious as to whether your model would also account for the difference between law in action and law in books. So you mentioned the WHO's phrase about infodemic, but during the COVID, we also see a lot of illegal infodemic, where people are having creative interpretation or misinterpreting the laws. So I'm curious as to how they will play out in your model. The suggestion for you is that I wonder whether you want to go a little bit more into the positive aspects of the technology in terms of court process or legal meetings. So you talk about a lot of the things that they can no longer do, but from a lot of the attorneys I talk to, they also save a lot of time in terms of, for example, in Texas, they have to drive very far away to do deposition, and now they can actually save a lot of time. They can do it through Zoom, so that means they can have more meetings than they normally have. One thing that is quite difficult, I think, is that the quality of information is very different, just like how we go to conferences. What type of information you get from online conferences is just not the same as what we get in physical conferences. And I suspect that's the same for a lot of those legal meetings. So to some extent, I agree with what you have, but to some extent, I also encourage you to explore the positive benefits of using the technology to do more different ways of achieving the court processes.
Great comments both. Thank you, Peter. In response to the first, I think that the question of, given the enormity of the research task that I already have, because I need to look back at the history of various proposals, and the discourse analysis will be mammoth and the number of laws involved. I think that getting through all of that in the book will be enough. In addition to this mapping, it's the first mapping of information policy as legal epidemiology. I think that the law, what happens on the ground in action would be there in future research directions, and I would have to leave that up to somebody else. I do have 2 other books I'm working on, but you're right that needs to be done. And you're right also, and it's in my notes, it didn't make it into the presentation, but those positive benefits, I finished this presentation 40 minutes before go time because it's all still very much in process. So I take your point absolutely about making sure the positive things are mentioned as well. Yes, thank you. Steve, if I may.
You're muted, Steve.
I'll start over and maybe say it's good to see you again, and nice to know you're still actively engaged in issues of real public interest. But I was taken by at the very beginning of your talk by the notion of legal epidemiology and bringing communication into this. So we end up with communication epidemiology, and it makes me bring to mind a personal experiment I'm running right now. I have a number of close relatives that see things like vaccine mandates, whether the election was stolen and things like that, very differently than I do. And it was recommended to me that for a good news source, I subscribe to the Epoch Times, EPOCH. And I've done that. You can get a trial subscription of 2 months for $1. I'm about a month into that. And it's clear that it's a very different filter on what is considered to be newsworthy. Right? But if you look at the New York Times, there's clearly a filter there as well. But the editors have to start with their own preconceptions as to what makes news, what constitutes valid information, and so forth. And we have, to some extent, there's an overlap, and to a larger extent, there isn't. So in Epoch Times, you'll see all the people that are talking about the unanticipated side effects of COVID vaccines. And their belief is this information is being suppressed. So I'm getting announcements like this almost every day through Epoch Times. But it brings us back to the question, though, of if we have a communication epidemiology, that presumes that there is some absolute way of determining what the real truth is, and that we have a way of agreeing on that. And I'm not so sure that's the case. And that's, everybody is applying their own notion of an epidemiology here to misinformation, what constitutes untruths, and so forth. And how do we deal with that?
So another great question. My entire teaching year is devoted to these kinds of questions and various versions of news literacy, or, how do we fact-checking kinds of courses with my undergrads. Just as point of information, the resource I'm asking the undergrads to use is Wikipedia's perennial sources list. I'm a big fan of Wikipedia. If you can publish an article on the Israeli-Palestinian conflict that all sides agree is accurate, I think it's a tremendous accomplishment. So they've learned how to manage disagreements and the kinds of sources people rely on very well. Their perennial sources list goes through the most commonly cited or news sources used in their articles, and or ones that have been challenged, and they do their analyses, and they go back to them. And so this list tells you when they last evaluated it. There's links through to what they looked at. And my students can only use something that has a green circle with a green check mark in it. So just as a tool. Steve, I know you well enough to know that fundamentally that you have some confidence in what is produced by the scientific method, even if it's challenged. I hope I'm not presuming here. But the question of the validity and reliability of what is produced through rigorous research methods, and the question of whether or not the public understands what that is and accepts it, are, in my mind, two different questions. So I'm still happy to rely on what what scientists say when it comes to understanding. And we know what the scientists also say about the percentage of people who've had ill effects from vaccines and all of that. So I think those are two separate questions. Managing the public discourse, we have failed at miserably for multiple reasons. And I think that's our real crisis as a society. It's as somebody who's been studying the nature of facticity as a social formation since the 1980s, certainly we are into the zone of abandonment. The metaverse will magnify that. You're walking through a room and you don't even know if you're in Venice or College Station. But that would be my response. I don't know if you feel that's an adequate response to the question you asked.
I think it's a good response. I don't know if it's an adequate response. And the reason I say that is that the people that are arguing that we've been misled as to what the scientific method really says about the efficacy of vaccines and their side effects. And what they're bringing out is, and there's quite a large number of highly reputable experts that will have criticisms of the policies we've used or our understanding what vaccines actually do. Like the notion that the spike protein actually doesn't get cleared from the body really quickly, as was originally thought. Then it can show up in other parts of the body, like the liver cells, and therefore you may end up stimulating autoimmune responses to what's happening there, right? So those are some of the arguments that are out there. The vaccine anti-vaxxers are saying this stuff has been suppressed in the interest, presumably, of public policy. And so they're arguing, they aren't arguing against the scientific method. They're saying that the debate has not been adequately represented. And I don't know how you respond to that, because there's always a debate in science, right? And the scientific method doesn't always give us, or rarely probably gives us, an absolute, undeniably true answer.
So I see I actually did not respond to the question you were asking, so I apologize for that. So this wouldn't be the first time. I mean, it is in the nature of ongoing scientific debate. Then the question is the sophistication of journalists in terms of knowing how to be more sophisticated about ensuring that they're covering the range of perspectives out there. Remember, the electric car disappeared. I mean, all kinds of things disappear. Damage from electricity keeps being suppressed, and other forms of radiation. So it's not the only area in which it happens. I would put that in the zone of how well, for a long time, it was a strong position in journalism education that journalists shouldn't be trained to be specialists in any area, with the argument that they would be captured by the industries or by the sources. I've always thought that was hooey, that obviously you can do better reporting if you actually have subject depth. So that would be a matter of journalism education and requiring people maybe, to choose a beat area early on and really gain deep subject expertise in it. That would be one possible remedy.
Yeah, and that may be a remedy. I'm not so sure anymore that we have real remedies, just because they feel they're time constrained and they're only going to spend a limited amount of time. And you pick news sources according to the biases you have, but the biases may have been developed by prior experiences, and so you think those are rational. I'm going to get my second booster when I'm able to, but I can see where these other people are coming from and how you can sort of fuel, if you limit the range of opinions and news you're presented with, these are alternative beliefs. And I don't know if there's any way of resolving that. That's my concern.
Right. I guess my quick thing would have been, if the New York Times, which I read regularly, in fact had better scientifically trained reporters, then when I'm going to that source, I would still get a broader view. But if I may, Marjorie, you had another question?
I did have a comment to make, but if I can just follow up on Steve briefly, I think this connects to your media literacy point. And I know from work that I did at RAND, which had this broad truth decay umbrella, that one of the arguments I got into with the person who led the truth decay work was about, can we always say that there are facts? And a lot of the people that I talked to who study information and media literacy talked about the importance of context. So it's like text and context. And that makes it hard to feel out both what is a fact, whether it's complete, and the other associated issue here is about the role of experts and expertise, which also factors in. So I know we're up against time. What I would have said had Steve not intrigued me is that you were, no. It was a great question. Just observe that your first inversion, talking about the uses and effects of technologies driving policymaking. When I was working a few years ago on the issue of big data and privacy, a lot of people were saying focus on the harms, that it's easier to deal with the harms and talk about them than to deal with the fear, uncertainty, and doubt that a technology would cause a harm. And you can see this debate played out in the privacy space in particular, but there has been a shift, and I won't say more, I'll just put that on the table.
Thank you.
Well, thanks everybody. This was fascinating. I mean, we could hang out a little bit longer if you want. I'm not sure what your time constraints are, Sandra. We can have like a gradual exit strategy where everybody who has other commitments is leaving on and talk a little bit more. But thank you so much. This was absolutely fascinating. And thank you all for participating. And what's your time frame, Sandra? Do you have a few more minutes, or are you?
Yeah, I'm all yours today. And thank you all for your wonderful feedback. It's the first feedback I've gotten and very much appreciate it.
Yeah. There was one question, if I may take. Oh no, Victoria, I'll let you go. Come on, join in.
Thanks, Johannes. Sorry, my video's off. My internet is acting up today. But the question I have is, when I think about law and policy and technology, I often think of the framework of sort of tech neutral policy versus tech specific policy. And I'm wondering if you start focusing on sort of the outcomes, whether you would put that within the tech neutral sort of bucket of policy, or whether you would consider that a third sort of bucket of policymaking framework, I guess.
Can you say more about what you mean by tech neutral?
Sure. So I guess, I think a lot about sort of artificial intelligence in the law. And so instead of thinking about, I want to regulate technology A from specific company, it's more about, I want to regulate technology that sort of performs like technology A in a much more general way. And so I think maybe tech neutrality is trying to get at what you're saying, but I just didn't know if maybe these terms are so unfamiliar, this isn't a good question, but I didn't know if you had any thoughts on sort of where you would place, because I really like the framework that you're working from.
Thank you, and I appreciate your introducing me to these terms. It's expanding my understanding, so thank you. So would another way of phrasing what you think of as tech neutral be focusing on the functions rather than the object?
Yes.
Okay. So it's premature for me to have a full answer to that yet. What I am doing in coding is distinguishing among the kinds of arguments used about technology, like it's implied because it's necessary to get the deed done, or it's specific to give the students laptops. And I'm also distinguishing between how they identify technologies, so internet connected devices versus internet connection and stuff like that. But this is very helpful as I think forward on it. And that's as far as I can go right now. One of my characteristics is, until I've really thought through something, I have no idea.
Well, I didn't have an answer in mind. So that I'm glad I might have spurred a thought. The only other thing I wanted to comment on was, I just wanted to thank you for introducing me to the term legal epidemiology. After 3 years of law school, that was never introduced to me somehow. And I do sort of health technology and law work. So I think that is sort of a game changer for me in terms of thinking about my own work and how the law, how I've been trying to figure out how the law interacts. And that is it. It's a social determinant of health. I just didn't know that term already existed. So I just wanted to say, thank you. You have changed a PhD student's life today.
Well, no, thank you. That's very interesting. I mean, it was new to me, but I hadn't been focusing on health in the past. It comes out of the law and society world rather than straight up legal scholarship, but it's decades now in.
Yeah,
So,
I don't know how I missed it. I don't know what I haven't been reading, but obviously I've missed a chunk of something I need to be.
I'll go ahead, blame it on your professors. Anyone else?
Thanks, Victoria. Any other comments? Sandra, could I just start, because we have to reschedule our own interaction. I'm tied up with like a provost meeting this afternoon, and so I can't join in those individual sessions. I was wondering though, let me just go to a couple of my questions. I had many more, and we'll have other ways to discuss those. One was, so if you look at the CDC website, for example, they define legal epidemiology as like a quantitative study of how law affects health outcomes, essentially. And from your talk, my sense is that that's part of what you're looking at, but there's a lot more effects that contrail effect really implies that many more effects happen that will only indirectly affect law, but maybe have lasting effects on many other areas of society, right? And a huge list of information policy dimensions that you mentioned. And so I was wondering whether that legal epidemiology framework scales well to the information policy issues. And relate to this question is this notion of the infodemic that you brought up, right? And I'm very critical actually that information travels like an epidemic, right? I mean, information, and it goes back to a little bit to Steve's question too, right? Information probably has other aspects, and you probably know the paper by Simon and Camargo in New Media and Society from 2021, whatever it's called, Autopsy of a Metaphor or something, but they sort of show how far the infodemic concept takes you, and then where it collapses because information spreads and is processed differently. And I'm wondering whether there is sort of a translation issue from the epidemiological framework to the information policy framework that needs to come into play a little bit to differentiate those two. I'm not sure whether my question is even clear, right? But I just wanted to throw it out to you and see what you thought about it.
Yeah, let me take the second one first. Thank you very much. I was just referring to the WHO's comment and the fact that misinformation and disinformation are problems. I haven't gone deeply into that literature, and so what you point to is a gap that actually I introduce it and then I walk away in what you saw today. So that trajectory needs to be completed, and you pointed me to some useful sources and a valuable critique. On the first one, I think it would not be surprising if there's a difference, 2 points. It would not be surprising if there's a difference between what's in the legal epidemiology literature that comes out of the law and society stuff largely, but not exclusively. So like Peter Hotez, whose vaccine is a big figure in this, and people were, lots of people were hearing from all the time. It's not a surprise there would be a gap between that and what the CDC says. And it's not a surprise, since you know my work well, that there would be a gap between either one of those and where I go with it. So there are 3 different things happening. I'm going to stand on the validity of my arguments until people rip the full book apart and say this is hooey. But I've always taken it as my job to work with and expand upon our conceptual and theoretical understandings rather than feel limited by what others have done. The CDC in particular, though, this is, I have just in the last few days been reading bills that go into excruciating detail about insistently, it has to be quantitative, and these are the kinds of data, and only these kinds of quantitative data. So I imagine that the CDC and what it says with its emphasis on quantitative analyses is responding to the political context in which it's operating in Washington right now, and that it's a defensive action on its part. And it's also true that there is that quantitative data. I'm not dismissing it. It's just not what I do.
Yeah, thank you. So are you, I mean, maybe it's just one quick follow-up, and I don't want to hold everybody else hostage in terms of letting them share more thoughts. Is that more sort of that more narrowly defined public health angle that the CDC has? Is that something that you want to sort of bring to the topic too, or sort of it's just embedded in the broader set of issues that you sketched out today? Because one of the fascinating things from a governance perspective is, right, how how Charles Lindblom's modeling through is actually being practiced big time right now, right? I mean, so the legislative and other toolkit that we have in response to the more narrow sort of question of how do we sort of navigate a pandemic, it's just mind-numbing, right? I mean, it's this game against nature and against disease traveling at high speeds, right? That is very difficult to really capture. And then all our models that we had, was sort of explanations like centrally governed countries have been more effective. They seem to collapse. Just wait long enough, and those imaginaries collapse too. And so I was just wondering whether that more narrowly construed question, right? How can we legally, politically respond to navigate a pandemic, and whether the health outcomes is also part of what you're going to look at, or whether you just focus more on the broader things that you discussed today?
It's a great question, and again, two pieces. I think that when so I take it as a positive recommendation that in the discussion of effects on governance, I should actually include the CDC as a specific section because of its relative importance for the US in that regard. So I hadn't thought of that. That's a great idea. I'll do it. In terms of making positive recommendations about what to do, that is possibly a spin-off journal article or something. But related to what I said about something Steve was asking for earlier, I think the project is already so large that's an additional intellectual endeavor and exploration that may or may, it seems to me unlikely as an outcome of the book. I may feel differently by August, but
yeah,
point taken.
No, so just two more thoughts quickly. I mean, pointers maybe. I mean, we have as you may or may not know, I mean, we have done a couple of empirical studies related to COVID and how people form an understanding of what COVID is, right? And in the first sort of round of empirical data collection, what we found is that there's in Europe, in the UK in particular, and in the US, there's one group of people who has a relatively sort of clear understanding, right? I mean, they're sort of close to the scientific consensus, right? And even if it takes Steve's points and say we don't really know what the truth is, right? There's a scientific consensus that's sort of seen as the closest to the truth that we currently know, right? Which is how the scientific method works, right? And we see people, a large group that is very close to this, and then we see a large group that is actually not close to this, and has very contrarian views of the sort of people typically who sort of believe in conspiracy theories and other. There's an association to the types of sources that they use, but it's very hard, of course, to figure out what's cause and effect here. But then there's a very large group of people who are confused, who cannot really sort of sort out what's the signal from the noise here. And we just completed a second round of empirical data collection, and then the third one right now. And so I haven't analyzed the data, but we'll be curious whether there was a sorting effect, in that where people sort of filtered into more clearer clusters, where the group of confused people kind of was reduced, right? And so that seems to be a huge issue. And then the other thing.
Can I ask a methods question here?
Yeah.
Among the things you're asking, are you probing for which sources of information they rely upon?
Yeah, and sort of there's a whole large number of questions on the information behavior and how do they source information, how do they update things like this.
Are you finding that those who are in the confused category and in the contrarian categories are more likely to be relying upon social media without an understanding of how to distinguish between what shows up in the social media from reliable professional sources and the guy down the block who got mad one night?
Yeah, we don't, okay? I mean, so that's, I think the whole social media discussion doesn't really hold up to the kind of data that we have. I mean, it's a factor, right? But there's mainstream media and right-wing media, conservative media seem to have a much more lasting and bigger effect than those. But that's, you know, I'm saying this with great sort of amounts of trepidation and caution, right? This is all this is all working progress. We also don't see as clearly sort of the whole debate that we currently have, that it's sort of it's Democrats versus Republicans. That's the heterogeneity of people is way larger, right? And what we did in our current framework is we added additional variables. So because we needed to, so we wanted to go below sort of the political affinity that we asked in the first round, and see whether, you know, you may know that moral foundations framework, for example, that is used in communication sometimes, and we use sort of other approaches on related to sort of belief in conspiracy theories. And so I'll you know, I'll report back what we find there, but it's interesting. But the second thing that I wanted to mention to you, just sort of to pique your curiosity, and this is beyond the book project, but I'm actually talking to a couple of folks in Sweden who work on complex adaptive systems. And they're sort of, they're essentially computer scientists modeling learning processes in populations, right? And they do agent-based models. And based on our conversations, they built a sort of a simple model and varied sort of the learning rates that people have, right? And how quickly they can learn things. And what they realized is that if you feed to a population of agents who have reasonable intellectual capabilities different information signals about what reality is, they almost inevitably split into, and this was eerie this morning, this was literally just before, like they literally split into a group that knows, is close to the real parameters of the world, a group that doesn't know, and then a large people in between that is confused. So we don't know whether this is completely purely coincidental. Right? And it's, I thought it is, because it's such a they use such a simplistic model. So there may be sort of some dynamic process going on, right? But where you have an emergent phenomenon, that's what people sort of know about the pandemic and how to respond to it. That is driven by just the dynamic nature of the disease. And I'm not, you know, again, this is literally, this is not robust at all. It was just really eerie to see them come up with sort of something.
No, it's utterly fascinating. Do you know the work by Yakov Shamir on the spiral of silence? He found that that the amount of information that what people knew when a spiral of silence began had an impact on how susceptible they were to it.
Yeah. And so anyway, I was actually for my own project, I was actually hoping to embed some of those things in the thing, but we need to talk about this separately. So I gotta run. I mean, anybody else? Any additional? This was absolutely, I mean, really fascinating. I love your big thinking, you know, giant picture, kind of putting lots of different dots together in a coherent and engaging framework. I mean, it's absolutely mind blowing.
Thank you, and thank you all.